So that girl, she came, third day she came walking. I was surprised to see her. I said, who is this girl? She said, sir, आपने मुझे ठीक किया. You have given me the injection. And then I suddenly remember it. Within 2 days she has recovered. First day no proper needling because she was uncooperative. Second and third day I did. Totally recovered. But not with all other cases. Because some cases are coming after 5 years, 2 years, 10 years. Sometimes post-operative cases. See, most of the times I tell the neurosurgeon, sir, just to burr hole. Make a hole, put the drain and leave it. But with that nobody will pay the money. So they will never listen. They will open the scalp. It is their procedure. I am not blaming anybody. I am also allopathic doctor. They remove the scalp, implant in the abdomen, and after 3 months again they will replace. And when they open the scalp, there are bleeding they will control. Sometimes during this procedure, some tissues are lost, brain tissue. Once it is lost completely. Nothing in the world can replace. See, if you have an injury here, for example, like that is the same in the brain also, we can stimulate this area so that the side areas that can be activated and they will regenerate the tissue, or they will take out the work of this one. With that, Papa, disturb mat karo zara. So, once this damaged area, we can stimulate side areas, no? So we can regenerate the tissue. And especially nutrition plays very important. Whatever your body is because of the tract, GAT, gastrointestinal tract. If anybody is having constipation, that is the biggest problem. Because once the constipation is there, digestion is not there. See, it should pass from above to below, starting from the mouth to the anus. Once it is not working properly in intestines, that means all the toxins are getting accumulated and improper oxygenation, improper digestion, nutrition is not absorbed from the tract. Once there is no nutrition, our brain won't work. It will work only 60%, 30%, 70%, depending on that. So always very important is nutrition. In most of the patients, sir, हम इनको daily बादाम, पिस्ता, काजू सब खिला रहे, लेकिन how much getting absorbed, digested, digestion, absorption, and excretion. If these three things are okay, you are happy. In the olden days, they were saying Guru-Shishya relation. So, when the training is over, Shishya was going out. Sir, मुझे कुछ blessing दो. वो बोलते हैं आराम से हिंदी में जैसे हकते पाते खुश रहो बेटा, हकते पाते खुश रहो बेटा. तो शिष्य से ये क्या दुआ दी है? आशीर्वाद दे दिया. After 2-3 days he comes. सर मैंने आपका इतना सेवा किया. I will serve you all my life, sir. Now you are blessing this one. ठीक है बेटा, मैं वापस ले रहा हूँ. I am taking back my words. Second day he comes running. नहीं साहब, मेरा वही ठीक है, वही दुआ ठीक है, फिर दे दो सर. So he says again, sir, तुम खुश रहो बेटा. So I am just telling you how GIT tract is very important, because from here the nutrition goes to all the systems, starting from the brain to the tip of the nail. What you eat, your health depends on that. If you are eating a lot of fatty foods, cholesterol deposition, cardiac problems, and any early age, if you get any patient with the early age hemiplegia, first to do is blood cholesterol and ask for the hereditary problems. Usually, the patient what I had is subclavian block, I took his family history. Like that, so many patients, but I remember this patient recently. So his mother also had 2 or 3 times attack, but she recovered partially. Then I said, you will have to protect your son also, because he also obese. So because it's a hereditary disease, you have to investigate the family and children, and before we get married, children, we have to start the treatment 100 days before the marriage, because once they conceive, in the genes the disease will carry. So we have to remove the disease from the genes. This is all herbal treatment, no allopathy. Though I am an allopathy doctor, long back I had been to China and learned this acupuncture. Along with that, I learned this in herbal also. So that most of the patients, they are getting very good results. And we are not money oriented here. We are work oriented and result oriented. See, some patient now, one patient is there more than 6-7 months. 2 days back only I told him, because he was operated by my friend here in Hyderabad, neurosurgery. His hand, how much I tried, it's not coming back. Though he is able to lift the hand little, but fingers are unable to listen. There is no command. Whatever the command, it's not good. But leg has come. So I told his wife and to him also, see now, try to go back home, change the atmosphere. If needed, you come back again. Because this is a post-op case. We don't know how much tissue was removed and what part was removed. During the surgery, see, once we open the brain, then we are all bleeding everywhere. So what we do? We do the suction, and we do the cautery, so that the bleeder will stop. Then if the patient comes late, there is no blood supply to the containing tissue, that becomes hypoxic damage, ischemic damage. Then naturally we have to remove that dead tissue also. Otherwise, other side tissues also become dead. So in that area, once we remove that dead tissue, the particular organ tissue, that's removed. So at that time, we cannot rebuild this. So, see, now the neurosurgeon, they will not follow our orders. Whatever is their procedure, they will do. So once the brain area part is removed, that cannot be reversed. That is very important. Just remember this. Because hemiplegia patients, they come with lot of hopes. You can recover to some extent. 90% you can recover, provided there is no part damage or removed during the surgery. So after 3 months again we will keep back the scalp and resuture it. Cosmetically is okay, but practically you cannot repair this. So in such case, tell frankly, because it's a post-op case, you don't know, try for 2-3 months. Or if you cannot try, you see, it is a complicated case, especially post-op case. you better refer the case.
Why you have to refer the case to us? Because neuroproteins are deposited because of lack of G lymphatic system, right? Yesterday I told you.
Yes, sir.
So these neuroproteins, they eat up the neurons. And after finishing the brain, if you bring us the patient, what will he give you back? So, I request you that complicated cases which you don't understand, it's not a case. It's a case for higher center. Because you don't have a setup. Can you apply such type of setup? Can you arrange 1 minute? In 1 hour, can you think of having a stem cells?
No, impossible.
Huh?
No.
Huh? Can you think of converting the chamber room into a OT room in 1 minute? Huh? I have 10 minutes discussion with Papa. Because he's a genius. That much only I know. I just request him, Papa, please. I don't know what this magical word means. But the meaning when I speak with this tone, Papa, please. Okay. Oh, what you mean? But together we have done our combo. It's an excellent combo. We have recovered cases of coma. You have seen this is 3 to
normal.
Our orthopedic surgeon said it's impossible to bring such changes. Forget about walking, speaking, even cognitive and emotional changes. He has become a normal human being. It was just possible because he knows about trachea. I'm afraid I may create a pneumothorax. He gets blocked from brachial area. I just tell him, Papa, I need this. Sometimes I tell him those things, Papa, you have to mix vitamin B12 in plasma and give brachial plexus injury, brachial block, and he gives. It's a dangerous things. It may create immediate pneumothorax. We don't have any equipment. Because in that building, we suffered very badly because the owners of that building never allowed us. So here, we got an open hand to work. Do your Siam in your center. Tomorrow, we don't have everything, but tomorrow you will see how finally my father gives a block. You can see the needle. You can see his orthopedic block. You can see his block. By going from here, you know at least where the needle goes, how the block is given. You may not try. I'll teach you some easy block, how to go paraspinally and press it. These blocks also will give what? Wow, MND wala patient, sister. First is MND patient. Second is फर्स्ट इज एमएलडी जो आज आया बाबा कितना केस लेंगे 2 या 3?
आज रात में तो एक ही करेंगे
तो एमएलडी कल 3-4 ले लें
From tomorrow morning we start. Sastri sir.
No, but then these boys will teach them.
Hey, आज एक कर रहे हैं ना? आज एक कर रहे हैं. Tomorrow? कल will. 3-4 केस tomorrow कर देंगे. जो सुबह चालू करेंगे. कोई बोल रहा है.
ये बात है इनको पढ़ाना भी है.
9:30 10 o'clock will start.
No, you will start and who will teach. I also want to learn.
तो ऑन टेबल करेंगे ना. ऑन टेबल will keep on explain to them. ये टीवी को कनेक्ट कर देंगे जी आपका. हाँ.
कैसे कनेक्ट करेंगे वहाँ?
आजा था कनेक्ट कर सकते.
लाइव कर.
मेरा कैमरा है, मेरे पास 2 लाख का कैमरा है.
कैमरा से हो जाएगा सब लाइव.
मेरे पास
नहीं, मोबाइल से लाइव हो जाता है ना. फेसबुक लाइव हो जाता है.
मोबाइल से टीवी को कनेक्ट किया तो हो जाएगा.
मेरे रिंग हो जाता है.
मैं पता नहीं क्या क्या है.
मैं कर सकते हो.
इसका वो पावर अडेप्टर मिल गया.
मेरे पास 2 लाख का कैमरा है. सतीश को बोलो क्या चाहिए तुम लोग को. I want that you see what we are doing.
Yes, sir.
इसका वो मिल जाएगा फर्स्ट वो उसकी लीड चाहिए सर उसका
Power
लीड
cable कल भी-
कनेक्टिंग इलेक्ट्रॉनिक
कल भी नहीं मिला वो
सतीश को बोलो, सतीश, अनिश को
टीवी
बोलो,
का वो-
टीवी का लीड।
पावर केबल नहीं है
पावर केबल
ऑन करने के लिए।
अरे बोलो अनिश को
कैमरा 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 नहीं
कैमरा मेरा पास है। ऐ, चटाई को बोलो, सतीश को बोलेगा वो स्पोर्ट लाने वाला था, ये लाने वाला था, क्या हुआ? हमको कल चाहिए बिकॉज वी आर डूइंग स्टेम सेल्स।
जो में
Yoma, call Anish, Satish, and you. So, most important part, instead of making things complicated, create successful stories. When you create successful stories, Satish, I told you for a camera stand.
कैमरा स्टैंड इज एक्चुअली
ठीक है. Now that has to be connected with our
टीवी
टीवी का पावर केबल
power cables का मालूम नहीं कहाँ से। अबे अरेंज करो, नहीं तो हम तुमसे शादी करेगा। अरे पापा तुम स्वागत करते हो।
सीएम टेबल भी है।
You know why I use this word? You see, it's so easy to stimulate the brain. Only you must know how to place the needle, how much stimulus to give. This is what I did the first day. I gave a joke of what? Choosing of balls. Jodi करेगा? Put. He started laughing. These definitions I just gave now, right? Intercepted in your brain. And you, what? Dopamine and was released instantly. Now you can understand playing with brain is very easy if you know how to play with it. Now,
छोटो पानी ला
टिश्यू दे रही इधर टिश्यू भी रखो ऐसा टैप
it's okay. Actually, IP taught me whenever because I have a severe pain, if I cough and that jerk goes to my spine, immediately he taught me you catch someone's hand and that jerk goes to
ट्रांसफर
jerk is
ट्रांसफर
transfer and my pain is
रिड्यूस
see. This is the magic of the brain. You need not know what brain is to do, how brain will do. Neurophysiology and neurochemistry and neuroendocrinology of the brain, it's very difficult. What you are asking me is neurochemistry of the brain. You are asking me neuroendocrinology of the brain, right? How it happens, what it happens. See, let us not discuss at this moment neurochemistry and neuroendocrinology of the brain. Let us keep it for as a future subject. First, let us bring results in our clinic and enjoy what? The recovery of the case rather than frustration of the case. I always see his face and I remember one word, sir, आपके साथ बात करने के बाद मैंने छुट्टी काट दिया था कभी कभी लगता मर जाए तुम बोला था ये बात
करने के बाद नहीं बोला था मुझे हाइपोथायरॉइडिज्म है और सोने से
जो भी हो तुम एक बात बोलेगा हम क्या इश्यू बनाएगा तुम जो भी बोलो एक बात बोलेगा हम उसका सो इश्यू बनाएगा तो बी केयरफुल ऑफ सेइंग दिस इज ब्रेन इफ यू गिव वन मिनट इफ यू गिव वन नेगेटिव इम्पल्स right I just gave him what I triggered him from 5 days right I gave him 6th day negative impulse he repulsed it कितना दिन सुनेगा right same thing is with the brain If you give negative impulse to the brain in a wrong way, what will happen? The answer is what? And if you stimulate the brain in a correct way, you get good results. All these days we struggle for one word called spasticity. Every day Papa give injections, every day we stimulate, and the next day this boy says, sir, wapas wake up is zero. Then Papa told me, beta, can you make something for spasticity? For 5 days, I sat like this. And when I don't sleep means I don't sleep. You can ask him. And on the 7th day, he has to give me a sedative to make me sleep. He says, he understands my cripple of my leg, that I have taken heavy stress on my brain to calculate how to, because I have studied artificial intelligence, algorithm, neural networking, in IIT Guwahati and other places. I know about threat antennas, right? So when he gives his cocktail, and immediately we stimulate the brain, what do we get? Permanent results. You have seen how many complicated cases we have. Tomorrow morning we'll see some stem cells in Parkinson's patients. Right. These stem cells in Mumbai are cost 5 to 20 lakh rupees, 25 lakh rupees.
Yes.
And you see, with just a small initiative and my speeding of the procedure, we bought all the machines here. Give there, prepare cocktail of father, put this, check on the NCV. How much result did you get? And now it is a center of what? Higher learning. No one can teach you better acupuncture than this in the world. You go to Shanghai University, you go to American Academy of Acupuncture, I can tell you, because he has gone to China. Many Indonesians, Nepalese, they have gone to China. There is no evidence, such evidence what we are giving here as of now. Even these boys who does not know anything about acupuncture, they have managed the whole acupuncture clinic here. It was so easy for me to teach them because they were receptive now. They agreed with my brain stimulation now. Now, did you see I got an entire lot of the clinic of 30 patients? Was your class disturbed? Why? Because Bimbek and Ganesh managed it so well that the culture of the living what? Farooq did not disturb me. So, what does Papa mean? Papa means, before you make a case complicated, any complicated case, you refer it to us. We will give it to you back. And that case will remain with you. See, neuro cases remains 8 months, 9 months, 10 months. How many times they will stay here? 2 months. Now we have better machines. We are buying RTMS, repeated transcranial magnetic stimulation. Can you buy that machine? Huh? Can you have Mohan Singh? Huh?
On the spot decision making really is a huge emotion.
You just see on the spot this decision or not. Stem cell was the decision of today, yesterday night, midnight. We were thinking, and today we are ready with the procedure. I only thought today is a life, tomorrow I am dead, I'll go without stem cell. मेरी आत्मा भटकेगी ये सिक्के पे था. See, we have got excellent team. He has joined our team. And today I can tell you, if you all join together, this will become what? I've toured 16 countries of the world. All these international patients are coming here. Within one year, we are having more than 200 bedded hospital. You will be tired of doing procedures and patients. This is my only 1 month in this center. How many?
1 month.
Less than 1 month.
Yeah, 1 month ही नहीं.
You see the magic. Today only we have put the board. Because yesterday police came to us and said put the board today. Immediately we have put the board. So that no one comes next time. An additional DGP of the police was informed. His brother was also IGP. So what does Papa mean? Papa means you all can excel. Papa encourage them. You know.
बोल रहा हूँ.
बोलो. मैंने बीच में इंटरप्रेट कर दिया.
So before you are getting the case filed, na, you our telephone number, me or Sastri, just refer the case. We'll keep him here 1 month, 15 days, whatever the duration. Then we send back and we advise the treatment. On phone we can nicely guide you, video calls and other things. So we have got very good facilities with TVs we have. And then we can show you the where to put the needles, how to put the needles, whatever things we do. And he has got very good simulators, the pen simulators, 4 types of them.
All 5.
So they work in different frequencies. How it works in the brain, peripheries.
Papa, as a HOD, you have been HOD of the best medical college, right? What is your remark about that stimulator? I'm asking you about as HOD.
It's
An external HOD, not as my internal HOD, external HOD. When you go as examiner, examining the patient, and me as examining with this pain, what is your assessment? Please tell that.
Most of the times I go as an examiner, professional. Because of this COVID, then recently they asked me to come to Bombay also. At that time, too many cases were taken, I refused. So when we go, the students, they come in the confusing state because such a vast syllabus. And what we ask, they are operating, they are in confused state. We ask the basic things first. If he is able to tell the basic things, yes, then we can array. He has some knowledge. Because everybody learns with the experience, not with the theory books. Theory we have the knowledge background. See, acupuncture you have very good knowledge. For some this thing LA4 where SP6 pair. But when to apply that? That comes with the experience. Once you see Sastri doing here or me doing here, for what case, when to put, how much time to put, how to simulate, after simulation what to do.
And whether you are getting results or not, evidence.
Many patients, they have taken the date for the surgery also. And lastly they said, चलो एक ट्राई कर लेंगे. One patient को Ahmedabad, bilateral avian, avascular necrosis of the hip. So he was advised surgery, everything.
In Gujarat, there was a post-COVID case.
So he came here. He just came to visit. Then first one day I gave him some simulation and he went back and said, I will come with my mother. He came back, he was telling, sir, आपका first simulation में उनको 50% कम हो गया था. You know, avian very difficult to treat. The vascular necrosis of the head of the femur. So very difficult to treat. He said, first treatment में मुझे 50% relief होगा. When he came here, within 15 days he was all right. But I said, you stay for 1 month.
So what was the treatment given? What was the treatment?
40%.
He gave acupuncture.
And plus by medicine.
Is medicine. and some of my brain stimulation.
Mm.
And the video is here. The
Same
Facebook.
again here, 9 needling.
Yes, yes. See, we have only one thing. Our weapon is, in this clinic, if you see, we have only 3 weapons. Papa 1, Papa 2, Papa 3 and all.
Dry needling.
Dry needling and brain stimulation. You ask any patient, they will not even say Papa 1, Papa 2. Whatever Papa he gives, okay. But brain stimulation and needling recovers the patient. This is what Avinash was saying. Avinash was not ready to believe. But I said, you examine each of my patients for 3 months. If I am wrong, I'll hand over myself to police. This was my precondition. Because I am a cheater. But if these patients are recovered, you have to become a regular physician. Now, yesterday's conversation with Avinash, you might have what the conviction. There is a medicine doctor, anesthetist, neurosurgeons are convinced that a transaction injury patient can stand and his knee is locked. An orthopedic surgeon has seen. Yes or no? Now we have orthopedic surgeon in our team. I am telling you, when I went to Singapore, the cost of treatment is so high, they cannot afford. They are looking for such centers in India. And that is why I started taking Zoom classes, so that we can help those poor people of everyone is not rich in Singapore. So, try to understand what Papa is saying.
See, when I treated these cases, hemiplegia, Parkinson, I gave in my doctor's WhatsApp group. So there are about 1,000 doctors. So there was so much of criticism. I gave my number also. If anybody has doubt, please they can discuss. So many people they wrote criticism and asked me so many questions and other things. I have answered them. But still, as an allopathy doctor, even I, before I learned this, I also never used to believe. ये क्या करता है needle mover. But when I saw it and did it practically, now you can see one live case. We have one Parkinson's lady. When she came, it was impossible to control her leg and her hand. Now 90% she has recovered in 2 months' time. It's a really miracle. There is no treatment in allopathy. Allopathy they use the Sindopa, this thing. But
And after taking Sindopa, the husband says, I am so afraid of this corporate hospital. He appreciates him like anything. But patient revived by 90%, 80%.
Parkinson, there is no treatment. Only temporary that tremors can control. Every third of our room, even my colleague professor, as a gynecologist, she also had this. When she was in army, husband and both, gynecology and orthopedic surgery. He was unable to control it. He was giving Sindopa daily, about more than 20 tablets she was taking. Then I reduced the tablets to 3. You continue with the 3, and whenever there is problem, you come to me.
Even in Shravan's uncle, you saw Shravan, na? We worked jointly. At midnight, you used to have Parkinson's chorea. It was like this.
Yeah.
And the neurologist, from 1.5 gram of Sindopa, he brought to 125 milligram of Sindopa. And that person yesterday, someone was saying, he walked, because his wife had a breast cancer. For physiotherapy, he walked 1.5 kilometers and came back 3 kilometer walking. A person who was a night trouble for me. I should say, Papa, please prepare his cocktail or I'll commit suicide. He used to do so much horror show here. But that patient also what? Parkinson's chorea revived. So, first of all, we never took an effort to revive this patient, right, Papa?
Huntington, Korea. One lady,
I'll call that Indralekha tomorrow.
31 years. From childhood she has this one. And अपने पास वीडियो भी है इसका, बताओ.
नहीं वो कल वो आ रही है.
हाँ.
कल
You can see the
इसको बोलो.
patient. Yeah?
हाँ? कल इंद्रलेखा.
If I
She
see-
could not speak from 7 years. Now she speaks like Trita, Trita, Tatum, Tatai, 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 Tatai. She speaks like that. See the treatment.
And it was congenital. And from childhood she had this one. So she is 31 years. She is an engineer, software, and working also. But she cannot control this thing. So now she started working. So tomorrow if she comes, you can see her.
What about Pooja? Dyson's muscular dystrophy.
Ah.
And CPK is 35.5. How much it is possible? 28-year-old case. पापा पूजा अपना पिया लो
मालूम
उसके बारे में बताओ
तो उसको बुलाना था.
वो बोला वो नहीं पापा उसके घर में क्या सबको वो रखा है कोविड उसके घर में दादा दादी सबको रखा है. मैं आपके चक्कर में नहीं बुला कहीं आप फिर 7 दिन के लिए एब्सेंट मार दोगे मैं मारा जाऊंगा.
So she was also unable to get up from the bed. कहीं नीचे बैठे तो बस she will sit down. To lift her, you need 2 people. Such a lady, can you? That is the congenital. From the childhood she had this one. I have gone through the whole history. So we have this one.
You can talk to her on the WhatsApp tomorrow. She will show you. And what about Sarat?
He transfers maladies case.
12 years with eczema. He did not wear slippers for 12 years. He used to wear only 2 socks.
And
7 days his eczema is gone.
And so much of sweating he used to have, palm and soap. Within a week's treatment I have corrected him.
You forget this is a patient. How much recovered you have become?
43.
In how many days? How many old days? How many old years?
15 days, sir.
5 years.
5
5
years.
years.
Example is life.
She had a
How
son.
much physiotherapy did you do in 5 years?
Everything home 70% of physiotherapy subject. Everything.
Oh, you know everything of physiotherapy.
Physiotherapy 70% everything.
He says that I know 70% of physiotherapy. And see, this boy could not walk and now it's on treadmill. Tomorrow I'll show you, after giving bone marrow, means what? Stem cells, brain stimulation, nerve stimulation, and Papa's cocktail. You'll see this boy is what? Where? On treadmill with the speed of 2 kilometers.
He was operated for a tumor in the brain, 4th ventricle tumor. It was removed. After that, he has all these complications. Bell's palsy, you can see him when he closing the eyes. One is
And what was the condition with the surgeon, you know, who got him? That this case cannot be recovered. And if I recovered, can you give me French kiss? If I bring him in treadmill, he's coming on this Sunday, and I said, he'll walk on treadmill on Sunday by the speed of 2 kilometers. Be ready with your French kiss.
So it will take some time, but he will recover.
He will completely recover. He said in 15 days, he said 50%. Who said? My statement. Whereas our equipment has just started arriving. We have just started working here. Right? OT table has just come. We are not able to give those blocks. Papa said aseptic conditions. Now this room will become what? Totally aseptic. And we are making 1 or 2 more cameras so that you can see whatever we are doing inside. You can see live. We will not bring you to the outer room because we might not have so many OT dresses.
Not visible also.
Not visible also. Congesting OT is not correct also. Distracting the physician is not correct also.
लाइट को पास कैमरा होता है
और डायरेक्ट टू व्यू मिलता है सर
वो बाद में लेंगे अपन कैमरा डायरेक्ट एक्सपोज करते हैं
सेंट्रलाइज्ड आ रहा है
हाँ,
फोकसिंग लाइट्स के बीच में से आ रहा
तो यहाँ से तुम अमेरिका बता सकते हो लाइव डेमो कर सकते हो if somebody want to see in US also they can see this.
So, my advice to you first is to buy the brain stimulation. Because you have only 2 options. Either you buy RTMS or this.
This is very easy. Pen simulator you can put in pocket and go anywhere and work. Other things you have to carry everything.
The cost of
So
RTMS is
fast.
what? I'm paying 50 lakh rupees. A machine which I thought of purchasing will get 50 lakh rupees. Conversation I started with whom? With the chartered accountant. To recover spinal cord injury, I need what? I just want to prove this pain is superior to because RTMS recovers in how many days? And this pain recovers in, you see, just pricking the needle has increased the size of the skull. Any physiotherapist can come and see. Lady physiotherapist was there, na? Huh?
She's gone. She left.
Anyway, she is joining me as a fellow student. बाबू वो उसके पिता एक्यूपेंचरिस्ट हैं, वो यही नौकरी करेगी.
कहाँ के हो?
पता नहीं वो नौकरी.
हाँ? हैदराबाद.
मैंने पूछा भी नहीं. मेरे को उसने बोला.
रेलवे स्टेशन
I know.
And she told me today morning, my father is interested in acupuncture. I'm a physiotherapist. What are you doing now? No job. So I want to study this. Okay, I'll give you some stipend. Are you ready to join me? He said yes. Come.
Yeah, nice girl. Subject is also very good.
See, the problem is only one thing. What do you want in your clinic? This is what my father said. Success or failure. We started with one room. His room was for my rest and my room was the clinic. Now from one room to this success in 6 months, you can understand what? Because there are pile up of cases. Cases are piled up. Once you have a stroke, paralysis continues. So, what are the things you need to learn? Brain, I'm bringing the brain microscope. We all will do dissection of the brains. With his help, since he was a HOD, we will get some brains from the forensic lab. आदमी का नहीं तो जानवर का ब्रेन दिला दो. कुत्ता बिल्ली का ब्रेन दिला दो, कोई तो ब्रेन दिला दो काटने के लिए. 2-4 मड़वा आदमी का ब्रेन मिल जाएगा.
आजकल किक का हाल है ना.
हाँ.
Kick their kick parts are very close to the human parts. Even that heart transplant.
That was done first by Dr. Borwa in Assam. He's another genius. Was sent to jail because of the mistake of his nurse. Not his mistake. Dhaniram Borwa. I spoke to him personally. He is the first person to replace human heart with pig heart. To my qualification, I am a very qualified person. But when I realized, when we can do nothing as a conservative physician, you forget, when he realized, he left anesthesia and joined this. He left his salary of 3.5 lakh rupees, 4 lakh rupees per month, Prime Hospital. I think more than 5 lakh rupees per month he gets. He left that job. And you see, he is working. Papa, why are you working here? Why you left that job of 5 lakh flat?
हम सब क्यों हो?
नहीं, फिर भी बताओ तो सही इनको. Why you were inspired of
You
working
have
here?
a work satisfaction here. The patient coming, तुझे भी प्लीजा, पैरा प्लीजा, huh? You see this boy. If he goes back to the positive result, how much satisfaction? It's not only the money. I told you beginning only. Don't work for the money. Work for it. Money will automatically come. Now after sometime you see this center, it is very small. We are going to shift in a 200 bedded hospital.
सर वो हर्बल के बारे में बताइए ना, आपने हर्बल सिखाना चाइना में जाकर, वो बताइए ना जरा।
वो समझ में नहीं आता भैया, वो मैं खुद बनाना पड़ता है।
अच्छा।
हाँ, वो भी मैं साइलेंटली बैठ के किसी को आने भी
So
नहीं
how do you
आता।
find the herbal?
See, I tell him, Papa, he has to say that for 10 minutes.
No, but where do you
And
find?
you see what he will do. I'll just monitor him like this, he will do nothing. When we all go, he close the room, he makes a cocktail, he comes, and exactly what time I want, sedation is done.
So, but where do you find the herbal trees
अरे,
and plants?
these are all very poisonous. Anesthesia, what we do, it's all poisoning. So many people they have committed suicide with those drugs. Even our student, one of my very beautiful girl, she was from Punjab. She came to the operation theatre night. And she was, I don't know what was the problem. She took the medicine, she took the muscle relaxant. She found her dead. Not only that, 2-3 anesthetists. So from that time, we will never disclose our medicine to anybody, even to our children also, because they are poisonous. Little overdose, can't live. So many times he told me, Papa, मुझे पता है, मैं बना के दे दूँगा लेकिन बोलूँगा नहीं. It's life threatening.
Other than soul, I can make all these medicines. And now, we differentiated and it is working perfectly. पापा का भी काम करता है, बेटा का भी काम करता है. खाली ये सोल जो है. Lastly, he said me go and find in internet. It was some charcoal, something. Huh?
Succinyl chloride.
I doubted that may be the medicine.
Muscle relaxant.
But then I doubt it is not. Because the moment I said this, he said no. Because even, you see, it is this habit not from now. Even in Arab, I'm telling you it's habit. Because his colleagues from Arab who are now in India, they came to meet me. So when he goes to Arab, he writes his cocktail in Telugu. And when he's in India or anywhere else, he writes his cocktail in Urdu. And he never throws his wines in the dustbin also. It goes in his pocket.
Secrecy.
See, nobody will touch my tray.
Yes.
Every doctor has his own anesthesia tray. My tray nobody will touch because they don't know what is this. Because in Saudi, I used to write in Telugu or Hindi.
And now you tell me, soul, toll, goal, mole, what will you understand? So instead of telling it soul, I become so confused with this cocktails. I named it Papa 1, Papa 2, Papa 3, Papa 4, Papa 5. Now it is very easy for me to combine these drugs. Right? I say Papa 1 means soul. Papa 2, another combination. Papa 3, another combination. Night we discuss, you will say, and you will write in the medicine also, Papa 1, Papa 2, Papa 3. I tell the nurses, please give me Papa 1, 2 and 4. This only I say, na?
Yes.
Do I say anything else? Some of the Papa I can tell you. But soul, I do not know what is soul. But that is a magical drug.
It is used where? All this? Spine, joints, everything?
Everywhere you can use it, and it's a magical drug.
I use depending on the case.
How you use it, I do not know. I use soul in all the cases. Without soul, I feel my soul is out. But then, there is one part. But you can get soul in the brain also. All the acetylcholine, dopamine. I have recovered even it is in there, in the internet, Myasthenia gravis, in just 6 hours. 25 years Myasthenia gravis, recovered in less than 2 hours. It is in the internet, it was a case of Gujarat. The father of the child said, 24 years disease did not even recover in 2 hours. So, my advice to you, deposit the money, buy brain. Because if you don't buy brain stimulation, please don't even call us. You can only call us for referring patients, but don't call us for help. Because our base of treatment is only brain
The
stimulation.
frequencies, different frequencies. It was arranged by a very good scientist.
Group of scientists you can understand, DRDO, Israel scientists and all. My brother was in DRDO and I got associated with IIT Guwahati. The story I told you, I was about to commit suicide because I did not get results. Same patient, same thing, same spasticity, what you faced, I faced. जो गाली आप खाते हो वो गाली मैंने भी खाई.
Baclofen injection and used as muscle relaxant for
No. Papa never used. Baclofen is very costly.
Not costly. So see any reaction with this baclofen. I pay, sir. I myself with the tablet. Oh my God.
Anaphylactic reaction.
I took it to my home. Then after 10 minutes I could understand I am getting reaction. Immediately I told my brother, wife and sister. I drove the car, hospital. I told the sister, please, doctor, see I am getting this diclofenac reaction, please give me some hydrocortisone. After giving that hydrocortisone and some other injection, I was okay. After 10-15 minutes I got up. Got up again, I was so giddy, I sudden hypotension, I fell down. Before I losing my consciousness, I told sister, please start IV line, give fast IV and give steroids, then I lost my consciousness. And that stupid lady, old doctor, she's 60 years, she doesn't know anything. So she was inactive. Then immediately all the doctors came back with the this one, defibrillator and everything. Then sister, what I told, she was active. Immediately she started IV line and they started giving the fluid, pressing the foot, and then give steroids and things after some times.
So which is the safest muscle relaxant which can use right?
Because muscle relaxants you give once, patient will not.
Paracetamol.
Muscle relaxant it will relax the muscle. Means it will relax all the muscles. Then
Not this.
means you are relaxing the patient totally. So that is why whenever he asked me, I said I will not tell anything. I'm very sorry. दो बाप बेटे हैं लेकिन ये अलग है, treatment अलग है. So I don't want anybody to die.
Sir, but my brother takes Nurofen.
Huh?
My brother takes Nurofen for muscle relaxing. The
Nurofen?
Nurofen 25 mg. He's told him to take, modify the dose. Either 25 mg once a day or split it into 2 halves because he has spasticity in the.
How long you take?
So he's been taking from 16.
What is the problem? With the allopathic medicine, it will suppress. What we are doing in diabetes, suppressing the thyroid. We are not stimulating the gland. But whereas, when I gave the medicine to our nurse here, 1 month, totally she has stopped the medication.
And then I would like to start.
I will give you some
That is
medicine.
why I always ask.
Reduce your weight also.
See, that is why I decided I'll not come out from my room. Right? I'll not enter in Papa's territory. Papa will not enter my territory. We divided our territory finally. Papa, better.
In 6 months, you will lose at least 25 kilos of weight.
No, so I've just stopped thyroxine because they had just started with 100 micrograms and I felt I can work out with yoga and pranayama and I've just reduced it to 25.
So
You take his medicines. I recommend.
you reduce to 25, yeah? You have done this one.
No, sir. I have when I checked it was a little low. So my teacher, she's a pharmacologist, so she told me to reduce taper the dose to 20. MD pharmacologist.
See, one thing
I want to stop this. I don't want to take external therapy.
See, you can take his medicine. The safest medicine. How he makes, I do not know. But these are his personal
You are from which place?
Bangalore.
अब उसका भाई है अरे अपना वो मल्टीपल स्क्लेरोसिस
He's taking it.
but then he has recovered 70% just because of his cocktails.
Yes, sir.
I have sent medicine to Bangalore and Mysore also. IBS, irritable bowel syndrome. With one dose, one bottle of this thing medicine, he said miraculous improvement. She said.
I would like to.
Everyone, see, one thing I tell you, you can take if you have some confusion, you can take medicine from him. Not only that, after talking to him, he have decided that we'll have an IP center in Mumbai with his help.
Yes, yes.
Yes,
We should have.
yeah. We have decided what? One IPA with IP Cherian. But only we are setting up things in such a way that in our absence, patients should not be
Inconvenienced.
inconvenienced. My problem is what you know. I cannot train them in a future way because they are saying Nepal is having a good career. Right? I said only one thing. Good career can be given by only Indian. Why? After touring the whole world, what is your opinion, Papa?
See, Indian doctors, they are the best doctors in the world, I tell you. Because I have worked in so many countries, only they have the machinery, other things, but knowledge-wise, nothing. Even in America also, Indians, wherever the Indian doctors are working,
13 out of 18.
huh?
Total 18